A tax on pop. That's one option researchers are exploring to help curb diabetes rates in Indigenous communities. But raising the price of certain drinks may not be the best solution.
A tax in some ways is about forcing people to make different choices instead of empowering people and giving them the resources to make or to eat well on their own. And usually given when people have appropriate resources, health improves.
Another challenge is deciding which sweet drinks should and shouldn't be taxed.
I can say that a pumpkin spice latte has just as much sugar as a Pepsi, but nowhere that has a tax is taxing those drinks. And Frappuccinos, from what we know from American data, are generally consumed by wealthier white individuals. And so this has racial and classist overtones in terms of what public health is saying is okay to drink. And we need to think about how this may impact stigma, especially towards already marginalized populations.
A key component for making sure the best decision is made is talking to members of the affected communities.
The road has been paved with failed interventions because we haven't worked with communities, and so that's really the foundation of this research, is to listen to, go to communities, have the communities lead the research, to be able to talk to community members and understand what community members want to improve type 2 diabetes and make foods more accessible.
Healthy, affordable options is what Michael Redhead Champagne believes will help heal Manitoba's Indigenous communities and help keep them healthy.
Because we find it ludicrous that in many inner city and isolated and remote First Nations communities and rural communities, the cost of vegetables and fruit is much higher than the cost of chips and pop. And we truly believe that people should have access to nutritious food, and it should be subsidized and affordable and accessible, especially to our most vulnerable citizens in inner city or in rural communities. We believe that food as medicine can prevent a lot of the chronic diseases that Indigenous community members are facing: diabetes, high cholesterol. These are all preventable, and we think that if people have access to the necessary amounts of food, healthy food, affordable food, then food truly can be medicine.